welcome to Medical Dialogues. I'm Roshni. Let's look at today's top headlines. Prescribe generics or face penalty, government asks NMC to modify controversial rule for doctors. In response to concerns raised by the Indian Medical Association and the Indian Pharmaceutical Association, the Union Health Ministry has directed the NMC to amend the recently introduced Registered Medical Practitioner Regulations of 2023. These regulations had included a provision to penalize doctors for not prescribing generic drugs. The decision to revise the regulations came shortly after a meeting between Health Minister Mansukh Mandaviya and representatives of the IMA and the Pharmaceutical Association. India, a significant global producer of generic drugs, has been grappling with the challenge of ensuring wider use of generics instead of brand name medications. While the regulations initially mandated doctors to prescribe drugs using generic names, concerns were raised about the practicality of this approach, particularly in cases where drugs have complex compositions. The Health Ministry officials emphasized that the requirement might not be feasible in all scenarios. Regarding the MCC NEET PG Counselling 2023, Round 2 seat matrix has been released. The MCC has released the seat matrix of Round 2 NEET PG Counselling, indicating the number of MD, MS, PG, Diploma and DNB seats available at various medical colleges for Round 2 counselling session for this academic year's admissions. According to 3 separate documents released on the official website of MCC, total of 15,075 seats are in the clear vacancy seat matrix, 8,142 seats are virtually vacant, and 260 PG medical seats have been newly added to the Round 2 NEET PG Counselling. The MCC kick-started the Round 2 Counselling with its registration process that opened on 17th of August. The last day to submit the online application form for Round 2 Counselling ended on 22nd of August. NMC bars prescription of anti-cancer drugs through Tele-Consultations by doctors. The NMC has introduced its inaugural telemedicine guidelines in India, indicating that doctors consulting through telemedicine are not permitted to prescribe drugs regulated under Schedule X of the Drug and Cosmetic Act. Drugs such as anti-cancer medications, morphine and codeine fall under this category and cannot be prescribed via telemedicine. Instead, the guidelines stipulate that only non-prescription drugs for common ailments such as topical antibiotics, antiseptics, antacids and cough suppressants can be recommended through Tele-Consultations. The NMC guidelines also propose that medications like antifungal agents for skin conditions, antibiotic eye drop for conjunctivitis and antibiotics for abscesses and laryngitis should be prescribed during video consultations. Notably, Tele-Consultations for add-on drugs which enhance or manage existing conditions rather than new medications for different ailments are unrestricted in terms of communication mode. These drugs can be prescribed via video, audio or text-based consultations as outlined in the NMC's telemedicine practice recommendations. Regarding the NEET PG, students who take admission under AIQ cannot vacate seats after Round 2. Reiterating its previous observations, the Supreme Court bench stated that students who take admission to the All India quota PG medical seats cannot be permitted to vacate these seats after the second round of NEET PG counselling for AIQ seats. While making this observation, the top court bench of Chief Justice of India D.Y. Chandrachud, Justice G.V. Pardiwala and Justice Manoj Misra referred to its 2017 order in the case of Dar-Us-Islam Educational Trust versus Medical Council of India. According to the rules, altogether 50% of PG medical seats belonging to AIQ are filled through a centralized counselling process conducted by the MCC. On the other hand, the remaining 50% of PG medical seats are filled by the respective state government. The Supreme Court took cognizance of the matter when a student who resigned from the seat allotted to her under the NRI quota approached the bench and sought its intervention. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.